The U.S. Attorney General Merrick Garland announcing the results of a DEA investigation into fentanyl, the deadly synthetic opioid.
The investigation findings said the DEA seized more than 10 million fentanyl fake pills and 980 pounds of fentanyl powder between May and September. They estimate that's enough to kill 36 million Americans. The DEA says fentanyl is a synthetic opioid that's 50 times stronger than heroin and 100 times stronger than morphine. Garland says now families should have open and honest conversations about the deadly consequences of fentanyl.
Make sure your loved ones know that they should not take anything that they are not prescribed, that they should not take a pill from a friend, and that they should not take a pill that they can buy on social media, because even one pill can kill.
It's a story we've been following closely, and WHS 11's Grace McKenna is here now with more on this and what happened today. Grace?
Yeah, Doug. Well, of course, that DEA investigation is called One Pill Can Kill. We spoke with local agents today who say a big part of the problem is disguised fentanyl, hidden in pills and powders being sold as other drugs. Plus, they're warning of an aggressive marketing tactic being called rainbow fentanyl.
One pill can kill when you don't know what it is.
They're fake pills. They've been adulterated with lethal amounts of fentanyl.
DEA agents like Louisville's Jeffrey Scott are fighting the spread of fentanyl. During a nationwide operation this summer, they seized millions of counterfeit pills laced with the deadly drug.
Statistically, there's a very good chance that that pill's probably been adulterated with fentanyl, and an equally good chance that it could be a fatal dose.
Scott says cartels are also rolling out brightly colored candy like fentanyl already found in 21 states like nearby West Virginia, and will soon likely find its way here.
It's marketing. I mean, I think it's branding. And I think in a way it's trying to target our most, young adults.
According to an annual report, overdoses rose nearly 15% in Kentucky last year. 70% involved fentanyl.
We know that nobody in our community deserves to die from substance use, and we have evidence-based tools that can prevent that death.
Louisville's health department provides harm reduction services like Narcan and fentanyl test strips. The challenge, fentanyl hides in other drugs, so more people may need the services than know about them.
So while we've seen an increase in demand, there's certainly a higher need than is currently being reached.
Scott wants parents to talk to their kids about fake pharmaceuticals, especially as social media puts them at their fingertips.
Computers and phones like that, the street corner is now in many of our kids' bedrooms.
As for the DEA, Scott says Louisville agents seized thousands of pills just last week, still waiting to be tested.
As many as we can, as aggressively as we can.
He says the best bet, though, is making sure they're never purchased at all.
And the Metro Health Department has 11 different locations where people can pick up Narcan test strips and get access to other harm reduction services. We have those on our website, WHAS11.com. In the studio, Grace McKenna, WHAS 11 on your side.